welcome to an introduction to our new Primo Radial Shockwave Therapy unit. As you can see, our new Primo Radial Shockwave unit is extremely portable. It will sit on any available electrotherapy trolley. Plug in both the handpiece and foot switch cables. You shouldn't get them the wrong way around, as there are different pin arrangements in each plug. The foot switch enables the therapist to keep both hands free to apply the shockwave treatment, and there is no trigger on the handpiece. When you are ready, plug in the mains cable to the power supply, making sure that the main switch on the unit is in the off position, and connect the power supply to the shockwave unit. When everything is connected, switch on the main switch and on-off switch, and the splash screen will appear. Then you're all ready to start treatments. Note that our new Primo Shockwave utilises state-of-the-art electromagnetic shock generation, so there's no need for a noisy compressor. It also displays the output as an energy in joules, and indeed energy density, as this is how many current clinical papers indicate treatments, rather than bar, a pressure. Although for comparison, the output is equivalent to 1 to 5 bar. It comes complete with 3 applicator tips, 6mm, 15mm and 25mm. And the tip that is being used can be selected here. Selecting this, the unit will register how many shocks each tip has completed. A selection of evidence-based treatment suggestions are programmed into the unit, along with user-programmable treatment selections. Let's go into one of the treatment suggestions. Then, as you can see, you're all ready to start your treatment. Our patient Richard has achilles-tendonitis, and once we've read and understood the user manual, we're going to do a treatment with our new Primo Radial Shockwave unit. We apply the coupling medium to the affected part, and when ready, we can activate the foot switch to start treatment. At the end of the treatment, which would normally only take a few minutes, just clean or replace the tip and membrane, ready for the next patient.